Thank you much, Sybil. Welcome back to Center Radio, Episode 2, COVID-19 here in Indiana County. We're trying to bring up-to-the-date news on how this pandemic is impacting our community. Next up, Dr. David Loomis, a retired professor from IUP and currently the editor of The Hawkeye, an online news source that has, from my perspective, about the most, the best investigative local journalism that there is around here for Indiana County. David, welcome.
Thank you. Good to be here. Thanks for inviting me.
Sure. So you recently wrote an interesting article on the Hawkeye about some questions, some rumors, and you ended up with some incomplete answers all around how is COVID-19 pandemic impacting Indiana County, particularly around testing and these things. Can you give us a little bit of a summary of that article? And we're going to share that as well and make sure folks have access to that to read that. Can you tell us a little bit about, I guess there's two questions. What are the things you found answers to, and what are the things you did not find answers to? So maybe the ones you've got answers to first.
So I would say I got very few answers. And the questions were mostly the kinds of questions that arise from a news junkie. So if you're reading the news and you want to know what the data that are published by the World Health Organization have to do with Indiana County, you might want to drill down a little bit and call your local officials to find out what they can tell us about how the rubber meets the road in Indiana County. So some of the questions concerned the numbers. I think when I started calling on Wednesday, I think it might have been Thursday, Indiana County, I think, had one confirmed COVID-19 case. I think that doubled within a couple of days. That's still real low. But that, I think, from other reading that I'm doing would suggest that that doesn't mean a thing, because it could be just the beginning of a tidal wave. I read a story in the New York Times this morning about the case of Germany. Why is Germany's death rate so low compared with Italy's? Italy's is one of the worst in the world, but Germany's is just a fraction of that. So what exactly is it? And there are some answers that suggest that social distancing and really rigorous enforcement of all those do's and don'ts that we've been reading about may explain why Germany is doing so comparatively well in the incidence of diagnosed cases and the number of dead that result from those. So that might raise questions about what Indiana County is doing to make sure that it stays Germany and not Italy. And so that prompted some calls to some sources, as the story that you're scrolling through indicates here, local health agencies, the local hospital, the emergency management director, and local elected officials. I would say that the local county commissioner, Shireen Hess, gave a bit of information that I thought was useful, and that was April 8th would be the date of a public meeting that would be conducted remotely by the county commissioners. That seems to me to be an awfully long time, given the circumstances that we're in. So that was newsworthy, I thought, and also concerning. The other thing is that no one wanted to really talk about what they're doing. It could be that they're really, really busy preparing for what could be a very bad situation even here in rural Indiana County. Or it could be that they just don't want to admit that we're not very well prepared. It should be noted that the county commissioners on March 11th did adopt a pandemic emergency response plan, which is an update on the county's regular emergency plans for whatever catastrophe might befall Indiana County. But the pandemic emergency response plan requires the county to get out front on communications, not just internal communications, but also external communications. And among other things, they say that there should be a public information officer for Indiana County to whom all the information should flow so that it would come out to the public in a meaningful and understandable form. And so far as I know, none of the pandemic emergency plans communications provisions have been adopted yet. And it looks like we might have to wait until April 8th before we can get any answers to those questions based on what the commissioners are saying.
So I appreciate that. It sounds like I got a message from Don at WRHP. We need to do a station break there. Brandon, if you can pull up our jingle there, and we're going to come right back to David. I appreciate that. We'll come right back in about 30 seconds. Looks like we're good. Great, thanks for that, David. So, what questions have been answered? You know, from your reporting, can you tell if the hospital is prepared? Where do we sit? I'm sure a lot of folks are reading, you know, these reports of really, really rough situations gradually moving closer and closer to our geographic location. I heard some really alarming stories from doctors in New York today about these sort of preparations, whether or not they're prepared. Is it your sense that IRMC in particular in our community is ready for these numbers to spike?
That's a really good question. And I do not have an answer for you because when I called the IRMC's public relations person, I got a response from an unnamed person. It was 2 days after I posed the question, and it referred me to the Pennsylvania Public Health Department in Indiana, Pennsylvania, at which there was a recording that said, "No one's here," and call an 877 number, which is a toll-free number from somewhere on planet Earth. But there was a queue of 21 calls ahead of mine, and I had other things to do. So I can't give you any answers to that, but that would certainly be a really important source to get some information from. So I'm assuming that we have very few ventilators. I'm assuming that we have very few masks at our local hospital, but it's guesswork. I have to make the guesses because of what I'm reading elsewhere. And also, I should note that, excuse me, the reason I started calling around was because of a rumor. And that's always an indication that there's a lack of information that people need in order to make informed decisions about such things as important as their family's health. And the rumor was that an intensive care unit nurse had become a COVID-19 patient and was in the ICU. And that raised some questions about whether that COVID-19 case was the same as the original case or a new case. You know, the questions just keep piling up. But I'm afraid the IRMC was not very helpful and was not very responsive, although I must say they did respond to emails. And when I followed the thread on down the line, it was still not very helpful. I have to hope that eventually the emergency pandemic response plan that was adopted by Indiana County will be fully implemented soon enough. I think one of the provisions my reporting showed was that there is a central source of information that Indiana County needs but does not yet have. And I think given the kinds of needs that seem to be suggested by what Sybil and Barbara were just talking about in terms of demand for meals at the Chevy Chase Center would suggest that there's a lot of people out there in need of some very basic things, not just meals, but also information. And, you know, the history of rumors in situations like this is not very good. And I can remember when I was here in Indiana County, I don't know, 10 years ago or more, and my family was in Washington, D.C., and the Beltway shooters were at work. And this was a guy and his adoptive son who were driving around the Interstate 95 and Beltway corridor in Washington, D.C., and picking off people at random with a sniper rifle. And I was, desperate to know what my family was doing to protect themselves. And the Washington Post and other media that were reporting on the story had to rely on one major source, and that was the Montgomery County Sheriff's Office, because that was the first case. And therefore, all the investigations flowed through the Montgomery County Sheriff's Department. And the sheriff wasn't talking. He would not talk. So the rumors were just flowing, and I heard them on the phone from my family. And it was not a very comforting scene. And so I think what the lesson I took away from that was that if you want to avoid a lot of rumors, make sure you provide the public with a lot of really good information. I think you see that in Washington, D.C. right now in a different context, and that is the context that involves the White House and Dr. Anthony Fauci. The unfortunate downside is that Dr. Fauci is being pilloried now for being a truth speaker. And I think the lessons that we should learn here is that we need someone who can speak the truth in a coordinated fashion pretty soon.
Mm-hmm. Yeah, I appreciate that. I think that communication piece of the county pandemic or county emergency operations, I don't think has been filled. I think it's one of the reasons this program probably got together, because there's a lot of information flying around, and to try to have a central source is important. I should let you know that we did get a response back from IRMC, from some spokesfolk there. So hopefully on our Tuesday show, Tuesday at 4 p.m., we'll be able to have somebody there from IRMC to be able to answer these questions. I'm sure folks there are working very hard to make sure they're prepared. And I think I agree with you. I think it's really important that they're able to communicate that directly to the community, because we continue to hear these horror stories. Can I ask you, if you've got another minute, this is your second article on the Hawkeye on the COVID-19. You had an article that looked at some of what the adaptations that IUP has been doing in terms of preparing for it. Now, I realize that's maybe 2 weeks ago, and the world has changed so much. Can you give us an update on that one? And we'll be sure to share that as well. So it's, again, some really great local reporting here.
Thanks. Yes, I can give you an update. Just to summarize briefly, the story was writ a little bit smaller than the story we were just discussing about Indiana County's preparations for COVID-19, and it arose from a whistleblower. And the whistleblower eventually identified himself, and he's a janitor at the school, and his sister also is a janitor at IUP, and his mom and his wife also work in health services. And the concern of the custodial guy at IUP was that the policies that IUP was following, this is the week when students were asked to come back and pick up their stuff and clear out, because classes in-person classes were being canceled, and the instruction was being taken online. So here's Carl Kunkel, the custodian at IUP, who was expressing his concerns about bringing home some pathogen from cleaning out the dorms that he described in very colorful terms. When you go to clean out a dorm that's occupied by a college student, it might be a job that most of us would not want to do. But Carl's on the front line, and so is his sister and other members of his family, and he was concerned that the administration was not hearing his concerns. So he was leery at first to come forward, but then he, on behalf of his fellow citizens, his family, he wanted to make sure that other people could be protected by speaking up a little bit about the problems that he saw on his job. And I texted him last night, and Carl responded that there seems to be some receptivity in Sutton Hall, the administrative headquarters of the university. And there is now a suggestion that before custodial workers go in to the residential halls, that they wait possibly as long as 2 weeks now, because, you know, the survival of the COVID-19 virus on various surfaces varies, and playing it safe would be 2 weeks. Who knows whether that will stick, he said, but he did say that the new vice president for administration and finance has directed apparently some of her subordinates to meet with the custodial staff and to listen to their concerns. And there seems to be at least some response. He suggests that they may know more at the beginning of the new work week.
That's great to hear. I think those sort of adjustments are important that administrators are making to be able to change their mind on things and listen to folks. We have seen in a couple spots there being threats of strikes and actual strikes from folks who we now know are essential and are demanding that they have the kind of protection that our other healthcare workers do, because these folks are in the line. Thank you so much, David, for being with us. Will you come back again and be on our show again?
Be happy to. Thank you.
Great. I'm going to transition now to our, I think, to the end. Sybil,
yes.
What's popping up for you this week since our last show that seems like something that we need to be paying attention to with the outbreak as you're following things from your community perspective?
I think the stimulus package, I'm getting a lot of questions about. It was passed last week, I think Friday or Thursday. It was passed Thursday morning, Thursday afternoon. Who is eligible for unemployment, because now we have a couple of groups that were not able to get unemployment before: contractors, per diem workers, and workers that traditionally just didn't qualify. They're now able to qualify for unemployment insurance. Also, the stimulus money, which is separate from the unemployment. When is that? How's the money coming? When's it coming? How much are you eligible for? And I think really a lot of questions about job insecurity right now. A lot of people that some of the restaurants here locally were open. I think there were 3 that opened, and they did follow the rules. They stayed open, but it was only curbside. But they have since shuttered their doors and decided that it wasn't profitable enough. And so we're seeing that, and that's just not unique here in Indiana County. It's happening in other places where businesses were open. They decided to stay open because they were allowed to, but it's not manageable. It's not profitable. So we're seeing a second wave of people now being in, and the unemployment office right now is totally 100% overwhelmed. Like they're not getting back to people. It's getting back on some of those questions. So I'm hearing a lot about that. The kids are getting a little antsy, and they want to know what's going on at school.
Mm-hmm.
Of course. And I do have a couple parents whose children do not have access to computers. One is a grandmother, and she's taking care of all 4 of her grandchildren. She is the main caregiver and does not have access to computers. And she's here in Indiana Area School District, and she wants to know how her kids are going to go online if they don't have computers and things like that. So I think people are just a lot of question marks for what the future holds right now, in the immediate future.
Great. I think some of those questions about schools, we're hoping to have Kathy Monco from AARIN, the Armstrong, Indiana Intermediate Unit, which offers services to school districts throughout the 2 counties, Armstrong and Indiana. And Kathy Monco is her position was the Director of School and Community Services
Yes.
help districts look out for those most vulnerable students. So we will hopefully be able to have her on and give us an idea of how districts are helping those most vulnerable students. With regard to the stimulus, I think you're exactly right. And our next program, in fact, on Tuesday at 4 p.m., we have confirmed Representative Jim Struzzi, who's the state house for our region. And I think those exact questions that we're going to be asking, we're also hoping to have somebody from Senator Casey or Senator Toomey's office to be able to go through exactly what is in the stimulus and where folks can find it. So that is confirmed. And also on Tuesday at 4, we'll also hear from IRMC, so hopefully be able to get some of those questions answered. I think that's going to be a wrap for our show today. I appreciate everybody coming. Again, this program will run Sundays at 2, Tuesdays and Thursdays at 4. We'll try and get the Facebook Live going each time. Regardless of how that goes, we'll always have a recording of the program that you'll be able to access via Facebook, also up on our website. Thank you again to our guest, Dr. David Loomis. Thank you to Barbara Croce from the Chevy Chase Community Center, Brandon Vick, Pastor Elizabeth Mount for engineering help, and Don Pappy Henry there in the booth at WIUP. Hopefully this went on the airwaves. Thank you so much, and we're signing off.
Bye-bye.